Hey digital diamonds, it's time for another digital gem. Are you ready? Let's go. Welcome back to Digital Healthcare Solutions, a healthcare network developed to equip, empower, and encourage a thriving digital healthcare nomad community. Let's bring some clarity to this unnecessarily complicated system called managed care. So just what is managed care? Managed care is a healthcare system that aims to control costs while improving the quality and delivery of healthcare services to its members. Members are individuals who enroll in specific healthcare plans provided by managed care organizations. And a managed care organization, which is often referred to as an MCO, is a type of health insurance provider that offers a structured or regulated approach to delivering healthcare services while controlling costs. Managed care organizations establish networks, also referred to as groups of selected healthcare providers, such as doctors, hospitals, and other medical facilities, who agree to provide services to members at negotiated rates. The primary goal of a managed care organization is to manage both the quality and cost of healthcare by coordinating care, ensuring that services are medically necessary, and providing care in the most appropriate settings. Managed care organizations typically offer various types of health plans to employers, families or groups, individuals, and government programs like Medicaid and Medicare Advantage. These plans may include health maintenance organizations, commonly referred to as HMOs, preferred provider organizations, referred to as PPOs, and point-of-service plans referred to as POS. Each plan with its own set of rules and network configurations. HMO members must use healthcare providers within the HMO network, except in emergency events. PPO members can use healthcare providers both in and out of the network, but out-of-network care usually costs more. And point-of-service plans members choose whether to use in-network or out-of-network providers at the point of care. The POS managed care system is a hybrid of HMOs and PPOs. So why should that be confusing? These organizations play a central role in the managed care system by attempting to balance cost containment with the delivery of high-quality healthcare. Now hold on. Before we continue to climb this hill of managed care information, let's also clearly define the members of these various managed care organizations. We briefly mentioned this a few seconds ago, but some things bear repeating with additional specificity. For clarity, members may consist of employers, families or groups, individuals, and government programs like Medicaid and Medicare Advantage. Employees covered by their employer's health insurance plan, which is a fairly common piece of an employer's benefits package. Often choose from the variety of health insurance options the type of health insurance coverage they prefer, that is, if options are provided. Upon being hired or during the company's open enrollment period, employees can choose from the variety of health insurance options provided by the employer. If the company offers managed care plans, such as an HMO or PPO, employees can opt into one of these plans, thereby becoming a member of that managed care organization. For families or groups purchasing health insurance on their own, these groups would need to contact an insurance provider directly, or through a health insurance marketplace, or exchange through online research, websites, agents, or call centers to obtain a quote and to secure coverage. Upon doing so, individuals within the family or group then become a member of a managed care organization. For individuals, the same approach would be taken. An individual would purchase health insurance on their own by contacting a health insurance company directly from a website, broker, agent, or initiating communication through a call center, thereby becoming an official member of a managed care organization. And beneficiaries, also referred to as recipients of government-sponsored programs like Medicaid and Medicare Advantage, or the Children's Health Insurance Program referred to as CHIP, may become eligible to become a member of these managed care organizations after meeting specific eligibility criteria, such as income level, age, or disability status. Okay, now we have established a solid foundation to build upon. Wait, we have some fun facts to share. Well, some might be overreaching, let's say. We have 2 fun facts to share. Fun fact 1. Did you know that the concept of managed care was inspired by the same principles used in airline ticket pricing? Just like how airlines manage seats and prices based on demand, early managed care pioneers applied similar strategies to healthcare. They figured out how to reserve medical services and manage costs by negotiating set prices with doctors and hospitals, ensuring care was accessible without breaking the bank. It's like getting a first-class seat in healthcare without the sky-high price tag. Which airline would you compare your health plan to and why? Share your what and your why in the community comments below. Fun fact 2. Did you know that HMOs have roots going back to the early 1900s? The first HMOs were created to make healthcare accessible for workers in remote locations, like miners. The workers pooled their resources to ensure they could afford a doctor's care. This model laid the foundation for the HMOs we know today. Can you guess the name of one of the earliest HMOs? Drop your answer in our community comments and give us a thumbs up if you're enjoying our content and community. Now, let's build upon that foundation by reviewing some of the more common healthcare providers within managed care systems that agree to deliver services to members at negotiated rates, thereby helping to control costs. Some examples include primary care physicians and general practitioners. These providers are often the first point of contact for most members. Both providers typically provide general healthcare services, manage ongoing care, and refer patients to specialists when necessary. In an HMO, remember, that's a health maintenance organization. Members of this system usually need to choose a primary care physician or general practitioner who serves as the first line of contact and coordinates its members' healthcare needs. Specialists. These healthcare professionals have specialized knowledge in a specific area of medicine, such as cardiology, orthopedics, or dermatology. Members may need a referral from their primary care physician or general practitioner to see a specialist in a HMO plan. An example of this would be if a member of an HMO plan presents with suspected heart disease, this patient may then be referred to a cardiologist within that managed care organization's network. Based upon the need for specialized care and subject matter expertise, hospitals. Hospitals within a managed care network provide inpatient and outpatient services to their members. These hospitals agree to the terms set by the MCO, including reduced fees for services provided to their members. Urgent care centers are another option. These facilities provide immediate care for non-life-threatening conditions for their members, offering an alternative to emergency rooms. Members can access these centers for issues like minor fractures or severe colds, often at a lower cost than an emergency room visit. And then there are pharmacies. Many managed care plans include a network of pharmacies where members can fill prescriptions at reduced costs. Now with this, a member might be required to use a specific pharmacy chain to receive the full benefits of their prescription drug plan. Make no mistake, managed care systems are designed to achieve several key objectives. They ensure that healthcare providers deliver high-quality care while keeping costs under control. They verify that medical procedures are necessary and suitable for the patient's specific condition. Additionally, MCOs ensure that care is provided by the most appropriate healthcare provider, and that medical care is delivered in the most appropriate and least restrictive setting. To control costs, managed care organizations establish contracts with healthcare providers and hospitals, agreeing on specific fees for each procedure and service. These negotiated fees, often referred to as discounted fees, are typically much lower than what the provider would charge in a private practice setting. Under this arrangement, the provider bills the MCO at the lower agreed-upon rate, and the MCO pays this amount. Importantly, the difference between the provider's standard fee and the discounted fee is not passed on to the patient, which helps to reduce overall medical costs for both the patient and the healthcare system. For additional clarity, in managed care, the terms reasonable and customary fees or usual, customary, and reasonable fees are commonly used. A usual fee is what a healthcare provider typically charges for a specific service. A customary fee is what other providers in the same area usually charge for that service. A great example of this is, if a general practitioner usually charges $65 for a brief office visit, this is considered their usual fee. If the customary fee in the area for a similar visit is between $60 and $70, then the provider's charge fits within the customary range, and insurance will likely cover it. If another provider charges more than the customary fee, insurance may only cover up to the customary amount, and the patient might need to pay the difference. Also, MCOs habitually assess medically necessary care. Under the signed contracts between the network healthcare providers and the MCOs, healthcare providers must follow predetermined specific guidelines regarding what procedures are deemed medically necessary. These guidelines are not publicly accessible and often restrict doctors from ordering extensive tests unless they are justified as necessary. The idea is to prevent unnecessary treatments that drive up costs. However, the impact of these restrictions routinely causes physician frustrations. An example of this might be if a physician thinks a certain treatment is needed, but the MCO doesn't agree based on their guidelines, the treatment might not be covered by insurance. Meaning, sometimes healthcare providers and MCO systems must carefully evaluate what tests or procedures are truly necessary for diagnosing or treating a patient. In addition to assessing for medical necessities, MCOs use utilization guidelines to help control costs. These guidelines assess whether a particular service or treatment is appropriate and necessary. If the MCO determines that a procedure is not necessary, they may deny coverage. Meaning, if a patient needs surgery, but the MCO's guidelines suggest that the procedure can be done on an outpatient basis, rather than requiring an overnight hospital stay, the MCO may deny the inpatient claim, requiring the surgery to be done as an outpatient procedure. Let's clarify what is meant by appropriate and least restrictive setting. This phrase refers to delivering patient care in an environment that fully meets the patient's medical needs, while avoiding unnecessary limitations or restrictions on the patient. Essentially, care should be provided in a setting that is best suited to the patient's condition, whether that be at home, in a clinic, or in a hospital, without imposing constraints that could hinder the effectiveness of the treatment or the patient's comfort and recovery. As you now better understand digital diamonds, each type of plan has its own characteristics, pros and cons, limits and restrictions, while changing frequently and making the lines between them often blurred over time. But that's the beauty of our healthcare and our community, forever changing and evolving. Well, Digital Diamonds, our objectives are clear, and we believe we achieved our goal once again. Along with your support, we are committed to building a sustainable digital nomad community by providing you with a variety of insights and information. And because this is our collective community, we deeply value and appreciate your feedback. So, drop us a message in the comments with your specific request or questions. With that, and until next time, and as always, we hope and trust this information will be used and shared as a valuable tool as you strive to be a digital diamond. But no matter what you do, remember, because you strive to be a digital diamond, you read everything, your knowledge is broad and expansive, you attract success, and you create the life that you want to live. Thank you for watching. If you enjoyed this video, please give it a thumbs up, click on the subscribe button, get engaged in the comments, and become part of the digital healthcare nomad community. Don't forget to hit the notification bell so you never miss a new upload. Your support helps us create more great videos for you.